Now, South Africa has recorded 12,739 COVID-19 infections. Just under 2%, or 238, have died from the virus. The Western Cape province remains the epicenter of the virus, with more than 2,500 cases and more than half of the total deaths. Also worrying is that the virus has made its way into townships around Gauteng. Well, to discuss the latest numbers and what we should be looking ahead to as level 3 regulations are upon us, Dr. Adrian Puren, the prof from the National Institute for Communicable Diseases, is joining us via Skype this morning. Prof, thank you very much for your time and good morning. Just first up, before we talk about how we should be interpreting some of these numbers very briefly, I just noticed from the latest statement from Dr. Zweli Mkhize, the National Health Department, the minister there, that the new tests, suddenly there's a majority test that were done in the private sector than in the public sector. Is that telling us something?
Well, I think that it's the ongoing problems or challenges that both the private sector and the public sector are facing with regard to testing. One, really, it's the numbers of tests that are coming through into both sectors. But I think also the fact that there are major problems with regard to supply of the reagents that are required for those tests. So it's possible that there may be some supply bottlenecks in the public sector, and that may well affect the rates at which those tests are currently being done in both sectors. So you may see swings and roundabouts with regard to those particular numbers. I think it's really a supply problem with those particular numbers in part.
But the good thing overall is that over 400,000 people in the country have been tested, and that's going to continue. Would you think the more prudent thing would be to do, as the government is apparently now about to change the focus into hotspots at the district level, that those districts must be empowered and enabled to do more tests rapidly?
Yes, I agree. I think the President did announce a change in strategy around the testing, rather than just simply broad community testing. Is ready to focus on, I think, the levels that I would think that will be recommended would be the healthcare workers, for example, the hotspots that you've certainly identified, and then in other vulnerable particular settings where testing needs to be done as well. I think what will contribute to community-based testing would be, for example, the use of the mobile facilities in order for people to present themselves and to be tested. And that will certainly, I think, add to the numbers that can be tested. But really, it's really about the prioritization of testing now, given that you've seen that there's a huge number of specimens coming through. The utility of that always can be questioned, and we've seen that happen. And so really, how do we prioritize and get results that are meaningful from a surveillance perspective as well as from a patient management perspective?
Yeah, we've got 12,739 positive cases. We have recoveries sitting at about 5,676. That's pretty much about 50%. Is that in line with what we've seen elsewhere?
I think it's very difficult to compare. I think there are delays in the reporting. So my view is that it's likely that those numbers could well be higher in terms of recoveries. It's just that there's a delay. But I think that the positive from that is that, again, we need to emphasize that this is a disease or an infection that is mild, and that people will recover. I think the concern are those individuals who are in particular age brackets and have comorbidities, that there is a concern. We're still seeing a low level of mortality. I think when you look at the trends, my view is that it's still at a low level, and that we can manage the scenarios currently.
Yeah, and Dr. Mkhize continues to express the national government's concern about the Western Cape and the Eastern Cape, which are emerging to be sharing more than half of the national numbers. And I just spoke to the Premier, Alan Winde, a short while ago, the Premier of the Western Cape, and he says they've made a proposal to national government of modelling as we get closer to level 3.
Yeah, so that's really critical. You really need real-time data in terms of your modeling exercises. You can't be dependent on specimens that were taken, say, 2 weeks ago. That's of no benefit. So it's really, as I said, the reprioritization in order for those models to be realistic in terms of the step down from level 4 to 3 to 2 to 1. You want to do that as rapidly as possible, so you need data to really understand what is happening. Focus your efforts around trying to look at who is infected, who can we isolate in order to try and minimize further transmission in the Western Cape and in the Eastern Cape. Again, it will be useful to know what the strategies are in Gauteng and KwaZulu-Natal as well, because those two are provinces that have, relative to all the other provinces, also have an increase in numbers of cases. At a slower rate, certainly, but we need to understand what their strategy is currently.
Another question that I would like to ask you, Prof, at this stage is we are heading into our winter season now. June will be here in 2 weeks' time. Autumn we're leaving behind shortly. We are going into our seasonal flu period. And many people will be getting flu symptoms. And we know that COVID-19, when you get infected, some of the symptoms are flu-like. What would your advice be?
So again, we've given that advice, and I want to emphasize that advice. So people who are at high risk, and we've got particular categories. Unfortunately, the numbers of vaccines that we receive in the country is fairly limited for both the private and the public sector. But I really would encourage the public to access those, especially if they are in those high category risks. So, for example, healthcare workers, it's essential that you get vaccinated. Then pregnant women, as another category, we really would like to see them because they are at high risk in terms of flu, as well as individuals who will have comorbidities. And those comorbidities are very similar to those comorbidities in the COVID scenario, for example. So those are the high-risk categories that I really would like to encourage that they do get vaccinated. But it also comes down to, and I'm so encouraged to see that we're talking about physical distancing, we're talking about hand hygiene, the surfaces must be clean. In fact, the President went through all of those again, and those are the key factors that will limit the spread of flu as well, the flu virus as well. So I really would like to encourage all our communities to participate in ensuring that if you can access the vaccine, access it soon, and if you can, ensure that you are physically distanced, that you're wearing your mask, that you're doing the hand hygiene. These are the key parts. I know that there's lots of discussion around schools and COVID, but again, the flu vaccine, the children are susceptible. They can be a source of infection. So again, those are the key things. The schools need to be prepared to manage those particular children in order to limit spread as much as possible.
Dr. Adrian Puren, thank you very much. He's, of course, from the National Institute for Communicable Diseases.